My name is Daniel Alvarez and my topic is Pharmacomechanical Catheter Directed Thrombolysis from Deep Vein Thrombosis. Definition: Catheter directed thrombolysis treats vascular blockage and improves blood flow by dissolving abnormal blood clots. A blood clot or thrombus can block off blood supply to certain parts of the body and cause serious damage.
A thrombus is a blood clot in a vein, artery or heart. A blood clot can completely or partially block a blood vessel. A blood clot can form either when blood flow is too slow or when clotting occurs when it is not needed. A blood clot can form in any blood vessel. A common type of thrombosis is a blood clot in a vein of the leg. We call this deep vein thrombosis. If the blood flow is obstructed, the blood can't be pumped through the vein anymore. This causes pressure in the deeper veins and capillaries, and the leg gets red, painful and swollen. This swelling is called edema. Possible causes of thrombosis can be slow blood circulation, damaged wall of the blood vessel, changes in the composition of the blood. There are some hereditary disorders that increase chance of thrombosis. Because of the contractions of your leg muscles, your blood is pumped from your legs towards the heart. The valves in your veins make sure that the blood can flow up towards the heart. If this muscle pump doesn't work properly, the blood will flow slowly. Slow blood circulation is also caused by prolonged physical inactivity, prolonged bed rest, for example after an operation, and after a long flight. Damage normally occurs in the arteries and veins. Because of unhealthy eating habits, smoking, diabetes, and high blood pressure may cause narrowing of the artery. Blood clots easily form over these narrowings, which results in various forms of thrombosis, causing heart attack and stroke, etc. Your blood normally contains substances that prevent spontaneous clotting. If these substances are completely or partially lacking, thrombosis may occur. There are also circumstances that change the composition of your blood in such a way that the chances of thrombosis increase. For example, pregnancy, use of oral contraceptives, and use of certain medicine. Thrombosis is treated with anticoagulants. Pulmonary embolism is a dangerous complication of thrombosis, whereby a part of the blood clot breaks off from the legs and ends up in your lungs. There are few things you can do by yourself to prevent thrombosis. Get sufficient physical exercise. Do some kind of exercise every 2 hours. Playing sports is good, but going for a walk or cycling are also good options.
Medical application. Catheter-directed thrombolysis is a minimally invasive treatment that dissolves abnormal blood clots in blood vessels to help improve blood flow and prevent damage to tissues and organs.
Shows how deep vein thrombosis, or DVT for short, forms. DVT is a condition where a blood clot forms in a deep vein, usually in the leg. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. The deep veins pass through the deep tissues of the leg. They transport blood from the legs and feet back up to the heart. The superficial veins lie below the surface of the skin. Here we show the position of the heart. The veins also have valves that prevent the blood from flowing back towards the feet. DVT is where a blood clot or thrombus forms in a deep vein. It partly or completely blocks the flow of blood through the vein. A blood clot can form if a vein is damaged, if the flow of blood in the vein slows down, and if the blood has a higher than normal tendency to clot. Here we show the blood clot forming in the vein. Many blood clots are small, and your body will usually be able to gradually break them down. Here we show a small blood clot being broken down, and the blood flow through the vein returned to normal. Sometimes a larger blood clot can form. A larger clot can completely block the flow of blood through the vein. Here we show the blood clot growing larger. A large blood clot may cause pain and swelling in the affected leg. However, DVT doesn't always cause symptoms. This is the end of the animation. Click on the animation screen.
Application in Ecuador. The placement of a central line is a procedure that is practiced every time more frequently at international level. In our environment, the reality is similar. McGee and Gould already in 2003 established that mechanical complications placing a central line occur in 5 to 19% of cases. Xu and his collaborators in 2015 indicated that only 70% succeed in placing a central line, that the 30% could present a complication of some kind with a rate of complication of 19%. The FDA described a range of complication of 5 to 20%, and in our country have similar results by placing a central line of 21% that can present an immediate mechanical complication.
Echos Corporation, developing innovative systems for ultrasound-enhanced drug delivery. Every year in the United States, over 2.5 million people are diagnosed with peripheral vascular diseases. The femoral artery is a frequent location for vascular disease. When atherosclerotic plaque forms in the artery, the blood flow decreases and clot forms, completely halting blood flow. The clot continues to increase in length, blocking more and more of the artery. A blood clot is composed of red blood cells and other blood components bound together by a matrix of aggregated fibrin strands. Thrombolytic drug dispersed into the clot will dissolve these strands and restore blood flow. Placement of a long introducer sheath provides percutaneous arterial access and is followed by placement of the guide wire through the clot. The Lysis drug delivery catheter is advanced over the guide wire until the tip of the catheter passes through the clot. The guide wire is removed, and the Lysis ultrasound core containing multiple ultrasound transducers is gently inserted into the drug delivery catheter. The drug delivery catheter is optimized to deliver drug uniformly through the side holes along the treatment zone. While saline infusion, to cool the ultrasound core, exits from the distal tip of the catheter. Delivered without ultrasound, drug dispersion is limited, with most of the drug remaining close to the sides of the catheter. Activation of the Lysis system increases permeability of the clot and generates radial pressure, driving drug into the inner volume of the clot. Simultaneously, aggregates of fibrin dissociate into individual strands. As thrombolytic drug is dispersed into the fibrin matrix, it surrounds each fibrin strand, dissolves the fibrin strands. As fibrin strands dissolve, red blood cells and other blood components trapped in the fibrin matrix are released into the blood. The lysis system simultaneously delivers drug and ultrasound energy along the entire length of the clot. The clot quickly clears, allowing the clinician to diagnose and treat any underlying lesion. When thrombolytic therapy is complete, the ultrasound core is removed and the guide wire placed back through the drug delivery catheter. The catheter is removed, leaving the guide wire in place, providing access for definitive treatment of the underlying disease. Adjunctive therapy results in unrestricted blood flow. The lysis infusion system, ultrasound-enhanced drug delivery.
Pros and cons. During catheterization of the internal jugular vein, ultrasound guidance reduces the number of mechanical complications, the number of failures, and the time required into the insertion. It is recommended that properly trained doctors use ultrasound in real time in jugular access during cannulation whenever possible, to improve cannulation success and reduce the incidence of complications associated with the insertion of large caliber catheters. Conclusion. The results strengthened the recommendation against the routine of pharmacomechanical thrombolysis as an adjunct to anticoagulation therapy in patients with proximal DVT. The procedure should only be considered in patients with extensive thrombosis involving the iliac and femoral vein associated with severe pain and swelling of the leg.
Echos Corporation, a BTG International Group company, offers a minimally invasive endovascular treatment to gently and completely dissolve thrombus and restore blood flow, while reducing the risk of complications. At Echos, our products are designed to treat smarter and achieve more. Here's how it works. When an obstruction such as atherosclerotic plaque interferes with blood flow, a clot may begin to form. Over time, the clot or thrombus increases in length and blocks more and more of the vessel. As the clot forms, plasminogen is incorporated into the fibrin. In order to dissolve the clot, lytic agents must reach the receptor sites on the plasminogen. The echosonic endovascular system facilitates this process. It simultaneously delivers both the lytic drug and ultrasound energy to the clot. Together, they quickly dissolve the clot and restore blood flow, without causing hemolysis or vessel and valve damage. Advance the echosonic infusion catheter over the guide wire and across the treatment site. Note that radiopaque marker bands at each end enhance catheter visibility. Remove the guide wire and the infusion catheter is ready to receive the ultrasonic core. Gently insert the ultrasonic core within the treatment zone of the infusion catheter until the luer fittings can be locked.
The echosonic endovascular system is optimized to deliver the drug only out of the side holes in the treatment zone, while saline coolant exits from the distal tip.